The Wisconsin Child Psychiatry Consultation Program is designed to address behavioral needs of children and their families through their most comfortable and common medical environment, their primary care provider.
We base our support to providers through 3 pillars: education, consultation, and community resources.
The percentage of my patient population that have behavioral or psychiatric, mental health, behavioral needs, I would say at least 40 to 50%. And certainly over the course of this past year with the pandemic, that need has definitely gone up, specifically amongst the adolescent population. I see families who are struggling, with teens who are struggling, and trying to find some answers and resources to help those kids has been really important this past year.
Consultations are super easy. We have a psychologist, we have psychiatrists, and we have resource specialists. So a coordinator will answer the call and figure out which kind of expert needs to answer that. So it can be multiple questions, it can be questions about anything and everything related to mental health. Phone calls are responded to within 30 minutes, and emails are responded to same day or within 1 business day.
Without the support of Cpcp, I'm not sure where our journey with mental health would have taken us as a family, but I'm sure it would have been a much more difficult and painful process.
Wisconsin's Cpcp is state-funded and is available to children across the state in every county through their pediatricians or family medicine doctors. And the program is free of charge to all pediatricians and family medicine doctors in the state.
I have taken the Cpcp CME courses several times, and I found them to be extremely helpful. I use them to really gain some competency in the areas. Now I use them as refreshers.
It's very helpful to have just overall reviews and refreshers of common conditions and the diagnostic criteria, some of the evaluation tools, and then the treatment resources.
This past year they had a wonderful speaker from the NIH on depression and highlighted some depression screening tools that we have incorporated.
My son is currently stable and doing great in school. I have more respect for my pediatrician for seeking out assistance and using Cpcp because we all don't know everything and need help. As the saying goes, it takes a village to raise a child.
So when a primary care provider calls and asks for additional resources for one of their patients, they work directly with a coordinator in their region to figure out what resources are available for those children.
Through their coordinators, they're able to find specialized psychiatric counseling that they haven't been able to find on their own, or psychiatrists.
Currently, in our state, 49 out of our 72 counties do not even have a single child psychiatrist working and providing outpatient care.
And what we provide is the scaffolding for education and consultation so that primary care providers can provide that kind of first step and that diagnosis and that treatment. The earlier you diagnose these things, the earlier you start treatment, the better the long-term prognosis. Why not enroll today by going to wicpcp.org.